Hi everyone, this is Adrien, the exercise specialist at the Leduc Beaumont Devon Primary Care Network. Hope you all are doing well today. For today's video, I thought I would show you guys some exercises that you can do when you're experiencing some knee pain. These exercises aren't meant to diagnose any specific knee injury or things like that, and these exercises won't necessarily cure all knee injuries or anything like that. So if you have concerns present with your knee, I don't necessarily recommend doing any specific exercises without being previously assessed. But some of these are common exercises that are often recommended for people to try and perform when you're experiencing pain, weakness, and some stiffness in your knees. These exercises are also often used for conditions like things like patellofemoral syndrome, sometimes some like extension mechanism pains, things along those lines. So I just want to show you guys a few exercises today, go through them, and so you can see kind of what they're like and how I would recommend them being completed. As usual, if you're new to physical activity, if you're returning to physical activity from a long layoff, or if you have a medical condition that might make doing physical activity difficult, please consult with your physician prior to beginning any new exercise program. Thank you. So, pretty much for all these exercises today, what you're gonna need is your body, a foam roller or something similar, and a band. You won't need these for all the exercises, but for some of them, they will definitely help. So all these exercises, what they pretty much do is they're working on the musculature around the knee itself, as well as some of the other supporting musculature that helps support the muscles that are around the knee. Some of them are to strengthen, some of them are to increase mobility, some of them are, to just help get things moving, help, mobilization a little bit, and everywhere in between. So let's start then. First one off, the first one is a stretching movement. So what we have you doing is you're laying down on your side, kind of like so here. When you're on your side, you're gonna go into kind of a recovery position. Hips are stacked, shoulders are stacked. From here, the next position that you're gonna be doing is you're gonna be bringing your top leg back slightly. So I'm pulling it backwards here to get a bit of a stretch through my hip flexor and my quadricep. And you take your bottom leg and you're gonna put it on your knee to help facilitate that stretch a little bit further. And if you can't hold it, that's okay. You can use this bottom leg to help push it back also. So you'll get a nice stretch through your hip flexor and through your quadricep here. So this exercise that can be done on the floor like I'm doing it, or even in bed or another soft surface. So generally this is an exercise we would like for you to hold 30 or so seconds for 3 or so rounds, or until it feels good. You can hold longer if you want. You can hold shorter if you need to, and you just want to push and find where you start to feel the stretch in there. So that's the first exercise. So that stretches the whole top leg. So the next exercise, we'll get out the foam roller here. So for this one, what we're going to be doing is we're going to have foam roller down. You're going to come up. You're going to be on your side. You bring your top leg over top to give you some more support. So you see, I have the foam roller here, and what we're going to be doing is we're going to be slowly rolling it down the side of our leg, so the outside, from our hip all the way down to our knee. And you see, using my arms and my legs, slowly push my way down to the knee and all the way back up to my quadricep, to my hip. You can go as fast or as slow as you need to. You can do slow little sections, go back and forth. You can go up, get that nice stretch in there. Feel that pressure. So this is where we're starting to get to some more deeper tissue work, some more compression type movements, where you're working on the pliability and the malleability of the tissues a little bit. Now there is a lot of conflicting research on the efficacy of this type of treatment, but a little bit of foam rolling here and there won't hurt anyone. to help loosen up all the musculature on the outside of the leg there. All right. So that exercise can be somewhat painful. So anytime you start applying a lot of weight and doing a lot of deep kind of therapy work, can be a bit uncomfortable. So be aware of that. Just because it is a bit painful does not mean that it is necessarily a bad thing. What we don't want is you to be in like a 7, 8 out of 10 pain. That's getting a little much. It's not really the use of this exercise. Certain times that level might be of a benefit, but that's not the point of this. So please do not push it to that extent. So the next exercises are actually going to be some manual stabilization exercises. So this one, you'll take the foam roller, or even if you have a towel, you could use something like that too. You're going to place it under your knee. So right here. So you're going to go under your knee. And what we're going to do is we're going to take our kneecap. So everything is just relaxed, right? Everything, your leg is relaxed. And then what you want to do, like up there, perfect. You want to gently take your hand and try to move your kneecap just slightly side to side. You can use your thumbs, fingers, however you do it, but slight side to side movements of your kneecap. So this is called lateral and medial mobilizations, because we're mobilizing it to each side. All right. Then you do the same thing going up and down. So let's get the leg out, gently push on the top of the kneecap, very, very gently. Let's push it down slightly. So you should see the kneecap move a little bit. And the same thing going up, pushing below kneecap. Just moving up, but just trying to mobilize it a little bit. Now this exercise, depending on people, everyone's mobility in the kneecaps are a little different. You don't want to have a hypermobile kneecap where it's going all over the place. That isn't good. I'm someone that has a very tight and very limited mobility in my kneecap. Something I might be able to work on a little bit personally. So that's another great easy exercise. Great easy exercise that you can do from home there. The next exercise that I actually want to show you guys, we're in a similar position here. So you have your foam roller or a towel right under your knee. And what I want you to do when you're here, what you do is you're gonna straighten out your leg. So my leg is in the air there, and you're gonna flex it really hard and then relax. Flex it really hard and then relax. Flex it as hard as you can and relax. So we would generally do a setup, 8 to somewhere to 15 repetitions of this for a couple of sets. Flex and then relax. Flex and then relax. Relax and then relax. It's a great way to get some additional stimulus in the muscles of the quadricep here. We flex and then we relax. And so that's a fantastic movement. So the next movement that I often like to show involves raising up your legs. So it's usually called a leg raise and external rotation. So you're going to be laying on your back. You're going to straighten out one leg. You're going to externally rotate. So you're going to turn your toes outwards. And then you're going to raise your leg up. And we'll do some repetitions of that. So you can see my legs. Make sure my feet are on camera here. So we'll use the left leg today. So you'll take your left leg, you're gonna raise it up just a little bit, rotate it outwards, external rotation, and then elevate it, and then down and back to normal. Rotate out, up, and back down to normal. Rotate out, and up, back down to normal. So similarly, you do this, 8 to 15 repetitions. You do the other side, right, external rotate, up, and down, back to normal. Up, rotate out, down, back to normal. So that's a fantastic exercise. We also recommend a lot of things like, seated leg extensions and things like that, which I have many other videos on the channel that I explain where you're seated and you're extending out your leg, really working on those quadricep muscles at that time. So, next exercise I'll show is the clamshell, which I know I've shown other versions of this in other videos before, but I'll show up this one. So I have my round circular band here. We'll be laying on our side here. So you see I'm supported here on my side. what you're gonna do, the legs are bent, band around these. You're gonna just bring your leg up and down. Nice and controlled, up and down. Up and down. Up and down. So what this is really doing is working the muscles of the outer hip here. All those hip abductor and external rotating muscles. I'm not going crazy. It's just controlled up, pause, and down. That's another fantastic exercise to implement. Often when we get issues surrounding the knee, there's oftentimes a lot of surrounding issues with hip weakness and things like that. So implementing some hip exercises are also of a great benefit. So after that, there's many other forms of exercises that we often like to implement. That I personally like to try and implement different types of squatting, for example. So just to briefly show you some examples of that. Probably won't be able to see me too good with the cameras, but I'll just show you quickly. It's more important that you see my legs anyway. So we have outward squatting, where your toes are facing outwards. And you're going to squat down with your knees out and back up. Knees down and out. Knees down and out. There's a further version where you're actually squatting with a band around your knees to give it a bit of extra tension. I know I've shown that in separate videos also. And then there's even a version where you put where you do wall ball squats, which maybe I'll show those in a separate video too. But those are just a few exercises that I wanted to show you guys. Most of them you can do for 8 to 15 repetitions, kind of like I have said, for a few sets. For the more stretching ones, those ones usually I would say try to hold them for 20 to 30 seconds. If you want to hold them longer, great, and try to do those for 2 or 3 sets as well. So I hope you found this helpful. Once again, these exercises aren't specifically shouldn't be used to try and diagnose any injury that you may have. You need a formal assessment for that. This video is not for that. This video is more just for explaining and showing some of the exercises that I often use for people that are experiencing knee pain at first. When it's more general knee pain, or when it's some things like PFS, patellofemoral syndrome, some mechanistic extension problems. But this is a very vague, broad example of just some of the exercises used. We have so many more depending on the individual's needs, but I hope you find these helpful. Feel free to try them out. If you have any questions, feel free to post them down below. Please like and subscribe to the YouTube channel. Thank you again. My name is Adrien. I'm the exercise specialist at the Leduc Beaumont Devon Primary Care Network, and have a great day.